Thank you, Dr. Catalano. We thought it would be valuable to learn about PYD in practice. Dr. Gina Wingood is going to provide some examples of PYD programs in U.S. and in Africa.
Good afternoon, and thank you for the invitation. You've heard several examples of sort of components of positive youth development programs. I'm going to talk to you about one specific program. The name of this program is SiHLE. SiHLE was developed by myself as well as Dr. Ralph DiClemente. SiHLE involved over 500 girls, African-American girls, 14 to 18 years of age. It was conducted in Birmingham, Alabama, as well as Atlanta, Georgia. This was a trial, which means that adolescents were randomized to one condition, a health education condition, or our HIV prevention condition. SiHLE is a Tier 1 CDC-defined HIV intervention that has been widely disseminated. Many HIV prevention programs, as their first session, discuss the epidemiology of HIV in adolescents or the epidemiology of STIs in adolescents. Some programs talk about condom use when they first meet the adolescents. Honestly, as the first session of a prevention program, adolescents aren't interested in these topics. We want to engage our participants. In our intervention, the first session is entitled Ethnic and Gender Pride. In our program, we framed artwork by female African-American artists. We read and discussed poetry by African-American female poets. For example, we'll read Maya Angelou's Phenomenal Woman and talk about how phenomenal the women are. We would also talk about role models. We would ask the adolescents, who's your role model? For many, it was their mother, their teachers, their grandmothers. We would ask them, why are they your role models? They would often say, they provide me guidance and lessons learned. In addition to this group-delivered intervention, which I'm telling you about, we've also developed sort of a technological intervention. Teens are so connected to technology these days, it's part of their identity. This is important as well because adolescents who actually go to the web, we can actually reach them much more effectively. As part of our program, we talked about values and goals to reduce their vulnerability to HIV. We asked adolescents to develop pictograms that talked about positive factors or more promote protective forces in their lives. They would talk about their family, their culture, their peers, as well as school. For many girls, of course, they do not use condoms. They have to actually ask their partner to put a condom on. This is a very hard skill for anybody, but particularly for female adolescents, who are often in relationships with much older male partners. Also, it's an emotionally charged situation. So it's very, very, very difficult, particularly when the males seem to have all the answers for dissuading women not to use condoms. What we would do is we would develop these vignettes to help actually enhance communication among the adolescents. Now, often when adolescents communicate about sex, they do so in a very passive manner. When this happens, the partners just simply ignore them. Sometimes, however, the adolescents are aggressive. When this happens, the male participants are either very sort of demeaning, demanding, or threatening. And we don't want to do that either. We want to take more of a middle road and enhance communication in an assertive manner. All these vignettes were developed by the women. Let's take a look at this vignette to see what it says. Getting your hair done. You're a bridesmaid at your best friend's wedding tomorrow. You're excited about going to the salon to get your hair done. You walk into the salon, and there's lots of women. After 40 minutes, she finally gets to you. It takes her 3 hours to wash, cut, and style your hair. You're tired of being at the salon. You look in the mirror, and your hairdo is lopsided. The beautician says she would like $60 for styling your hair. What would be a passive, assertive, and aggressive response? A third of the women in our sample actually had histories of abuse. So it's quite important to talk about healthy as well as unhealthy relationships. We define what are healthy relationships. Specifically, we talk about healthy relationships as being relationships in which power is balanced, communication is good, trust is strong, and respect is real. We also look at the relationship between having an unhealthy relationship and vulnerability to HIV. Obviously, if you're in an unhealthy relationship, it's much harder to negotiate safer sex, and it's obviously much harder to engage in safer sex practices. We also take a look at how do you select a healthy partner? How do you promote more sort of positive, healthy relationships? Let's take a look at some of these scenarios that the women developed themselves. Dion is 26, has a nice ride, and a good job in computers. He has a great sense of humor. Dion is always at the clubs and has lots of female friends. You heard that he cheated on a friend of a friend. Would you hook up with him? Anthony is 23, goes to school at Morehouse. He's really cute and is an alpha man. That's a fraternity. He's really smart, but you heard he's pretty mean to his ex-girlfriend, and he talks down to her a lot. Would you hook up with him? Khalil is 24, was a basketball high school star. He's in shape, drives a hoopty, and also has custody. Khalil is a responsible father. Khalil wants to get married and have more children. He's thinking about going to college, but he does not have the money. Khalil works as the manager at the mall department at a local mall. Would you hook up with him? Now, from our status as maybe educators or doctoral students or master's students, we're like, no, I wouldn't hook up with them. But remember who we're talking with. We're talking with 14, 15, and 16-year-old girls. Their thoughts are different. SiHLE has been adapted globally, specifically in South Africa, Spain, as well as the Caribbean. SiHLE was published in the Journal of the American Medical Association in 2004. It's been widely disseminated, but let's take a closer look at the results of SiHLE. Specifically, SiHLE was able to enhance consistent condom use. What that means is using a condom every single time you have sex. It's important to actually think about these results. What we did is we actually said, after the 4-session intervention was over, we followed women for 1 year or 12 months. So at 12 months follow-up, adolescents were more likely to consistently use condoms. They were less likely to have a new sex partner. They were more likely to negotiate safer sex. They were more likely to have more positive or social norms supportive of using condoms. Noteworthy, they were less likely to have a sexually transmitted infection, and this is a biologically confirmed infection. Additionally, there were very positive results on pregnancy. This is just one example of a positive youth development programs. There are many examples, and thanks to our fellows here, we're really disseminating them. Thank you so much.